Hi everyone. Thanks for being here. I think we'll get started. So to set the scene about health equality being within a social prescribing conference, I've put together a couple of slides that just helps us with some of the terminology that we might be using. The difference between equality and equity. So equality is when we are all given the same access or opportunities, whereas equality is taking into account what people need, maybe how things have been distributed in the past and correcting for that. The social determinants of health have been discussed throughout yesterday and today. I think that I'd just like to read some quotes from the World Health Organization, who articulate it very well. So the social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live and age, and the wider set of forces and systems shaping the conditions of daily life. These forces and systems include economic policies and systems, development agendas, social norms, social policies, and political systems. The social determinants of health have an important influence on health inequities. The unfair and avoidable difference in the health systems or the health status seen within and between countries. In countries at all income levels, health and illness follow a social gradient. That is, that the lower socioeconomic positioned people are in the worst health. And when we look into how these social determinants are defined, you'll see that they are talking about access, proximity, and affordability overall. But also when you look into account like the social and community context, they have elements of community social supports and discrimination, and as well as neighbourhood and built environment to talk about safety and opportunities to exercise. These all influence our socialisation. This is a figure from my PhD student's paper at Chimile, and it's just demonstrating how interrelated these concepts are. The point I'm trying to make here is addressing one aspect at a time is not likely going to be optimal. As in healthcare, we need to think of a whole of person approach, and that's including social prescribing. The fourth point is around where socialising fits within our hierarchy of needs. This is Maslow's hierarchy of needs. It's through motivational theory in psychology, and usually depicted as a pyramid as shown here. So here love and belonging is situated after psychological needs and safeties, so therefore addressing social health through social prescribing group activities is likely to be beneficial after the basic physiological needs of air, water, food, shelter, etc., as well as safety needs are being met. Great. And so today what I'm going to do now is give the opportunity for everyone to give us a point of discussion, and then we'll be asking for everyone to help us maybe continue the discussion.